Right, you can start.
Good afternoon, everyone, and I welcome to today's session. I welcome to General Practitioners Association of Goa. I thank Dr. Harish Shetty for always being there for Goa, and he loves Goa and Goa doctors. Thank you, Doctor. Today's topic is bouncing back virtues, new learnings. And I would like to uh, introduce Dr. Harish Shetty. He doesn't require any introduction. He is a well-known consultant psychiatrist from Mumbai City. Dr. Harish Shetty is a psychiatrist with extensive experience in the field of mental health, especially in connection with disasters. He has worked at Latur in 1992-93 for a year, at Kandla after the cyclone for a year, evaluated the psychosocial processes at Jabalpur and Gujarat after the earthquake for a human rights group, and also worked at Gujarat after the last riots for 6 months. This was on the invitation of Amrita Ben Patel, then head of NDDA. Dr. Shetty has worked extensively with the youth and works with an educational institution every week. He has also provided mental health intervention to seafarers after their release from the clutches of Somalian pirates. He is a governing body member of NTA appointed by Government of India. I welcome Dr. Harish Shetty for today's talk, and I request him to please.
What a beautiful afternoon today to be with doctors from Goa. I think I'm really blessed and happy to be with you all. It's a long time that I have interacted with my dear friends and doctors from Goa, and I thank Dr. Samuel for inviting me. I'm not going to talk about COVID much, but I'm going to thank everybody who have followed the COVID protocols. My best wishes to all those who have been infected and are recovered and are recovering, and my condolences to all those who have lost their family members in COVID. And may God help them face this loss with great courage. And as I start this, I've always said this all my life, that the family physician, it should read family physician, is a sun in the galaxy of medicine. Let me tell you, it's easy to be a psychiatrist, but it's very tough to be a family doctor. I'll tell you why. A patient comes back from a consultant and actually talks to you about the adverse effects of the drug, and you are supposed to know about it. Any consultant, it could be a psychiatrist, it could be a physician, it could be a cardiologist, it could be a surgeon. You need to know everything about everything. And that's why I call the family doctor, as family doctor is a sun in the galaxy of medicine. I had used this term and in a book which I wrote long ago, From Mental Illness to Mental Health. When I say this, I would also like to show some information which is very important for you before we get into the topic. My dear family doctors, are you aware that almost one out of 6 people who end their life by suicide are housewives? As a psychiatrist, when I was trained, I was told that single women are more at risk for suicide, but now it is the housewives. So I would like you to understand and appreciate that when you sit in your clinic as a family doctor, pay a little more attention to the mental health of women, especially housewives, and check whether they are depressed or not. Along with that, I would like to give you a very important information. This is not from my place. It's basically an information which is there in the realm of public. 1 out of 3 people who actually die of suicide are due to family problems. So the role of the family physician is extremely important. So important that a family physician can actually prevent a lot of suicides if they're very alert much earlier. And the second is at least 1 out of 6 people who end their lives are because of other illnesses. That points to the fact that comorbidity of psychiatric illness is very high among diabetes, stroke patients, hypertension, post myocardial infarction, kidney disease, etc. I still remember this young man who was an alcoholic, who stopped his alcohol, and the family was very happy because he became very quiet. He was wild when he used to drink. He was violent when he used to drink. And they all were rejoicing because atta to gappa zalo. And when he became gappa, they did not know that it was depression. On the 21st day, when he stopped alcohol, he committed suicide because he was depressed. Alcoholism and depression are like first cousins. Always screen those who take alcohol for depression, and screen all those who are depressed for intake of alcohol. Similarly, a patient who had diabetes got his sugar controlled, he became very strict on his diet, did all his exercise, and then he became the best dada of the family. And when he became the best dada of the family, people are very upset because they were used to a very nice, angry, verbose, extroverted gentleman. And when I got a call from the family, we do not know his personality has changed after his sugar was controlled. And then when I screamed him on PHQ-9, remember, I'm going to use this word PHQ-9 very often, Patient Health Questionnaire 9, self-rating questionnaire, which you can use, patient can use on himself. And I found his score was moderate to severe depression. When I screened him, he said, I do not know, but I feel very sad. I feel very depressed. I feel like crying. And we do not know why patients with diabetes get depression. 20 to 40% of patients with diabetes also have depression. So controlling the sugar is not enough. What is very important is also screening for depression. So my dear family doctors, family problems, very important. 1 out of 3 people who end their life by suicide in India have family problems, and 1 out of 5 or 1 out of 6 actually are ill. Or now Goa is number 10th on the suicide list. The average suicide for India in the year 2019, that's the latest figures available, is approximately 10 per 1 lakh of population. But Goa stands at 16.8, and that is something to really worry. Now let's look at what happened after COVID. There are 3 types of people: those who have put their mask properly, those who have actually done all those things that they should do, hid in their house, did not go out, stayed indoors, had whiskey or whatever, and they were very mindful. They followed all the SOPs, all the protocols. They are very euphoric now. Hum bach gaye. Nothing happened to me. We followed the right protocols, we did the right thing, and they're very euphoric. And they give long lectures in Maharashtra. We did this, we did that. And I mean, you have to follow this, and things could happen. But I do not agree with them. COVID also happened even after you followed all protocols, because the virus was very cunning. It was invisible and also had a long impact phase, which means it hit us across 19 months. Unlike an earthquake, where earthquake comes and goes, unlike a cyclone where water comes and goes, and unlike a flood where you have a flood and you then completely forget it. So these guys are very euphoric. And then you have these reckless guys. I COVID guy. In Maharashtra, there are quite a few. I don't know about Goa. COVID is a government conspiracy. कुछ COVID नहीं भाई, कुछ नहीं है, कुछ COVID नहीं, सब झूठ है भाई. अपने को तो कुछ हुआ नहीं, अपन तो मैकेनिक है, अपन सब करता है, अपने कुछ हुआ नहीं. So these are reckless guys who are very ecstatic. But the third group is very different. Well, those who recovered after having COVID have become very compassionate. A lot of doctors who would not call up the other doctors, would flash their car keys, and were very proud of the hospitals they own, have become very humble. Simple. So what happened due to COVID? COVID told us कि भाई तुम्हारे हाथ में कुछ नहीं. You can build intercontinental ballistic missiles, you can build the best guns on the earth, You can have whatever, but I am an invisible virus. I can pull you down. I can pull you down. Mortkem, they say in Goa. That's what I read somewhere. But and all those who are recovered are very compassionate. They have become very kind. And without the intervention of the psychiatrist, their nature has changed completely. And these are the three important changes we see in COVID. I would like to share this phrase by Dr. Harish Shetty, that in your practice, what you actually need to do is that you need to help locked minds open their mind, because it's so important. It's so important. And if the minds are locked, it is like time bombs. Diffuse it early, lest it explodes inside you. So one of the main tasks as a mental health professional, one of the main tasks as a family doctor, in fact, you guys are all mental health soldiers. You are frontline border security force on the borders of the McMahon line, preventing mental illness, promoting mental health, and assisting in the treatment of mental illness. So this is a sentence should be there on your lips all the time. Samuel, I'll send you all the slides.
Yes, sir. Yes, sir.
You can share
Yes,
it
sir.
with everybody.
Definitely.
There is nothing like patent. I mean, ideas have to be shared. So I'll send you all the slides. So
Sure,
locked
sir.
minds are time bombs. Diffuse it early, lest it explodes inside you. And you all know that mind and body are in constant conversation. And in this conversation, there has to be harmony. Disharmonious conversation can lead to the body crying. And when the body starts crying, the pancreas goes on a strike. It says, I refuse to give you insulin. Calcium says, I'll go and deposit myself on the cardiac vessels. And the stomach says, I will not give you any digestive enzymes to digest your food. And the liver says, I'll be very sluggish. I'll not clean your body the way you want to. So the mind and the body have to be in constant conversation. The body and the cosmos have to be aligned. And that's what health is all about. Let me tell you what happens after the COVID. And you'll get a lot of patients like this, panic attacks. In fact, it is said very, very unofficially that Raj Kapoor played that instrument when he saw Rajendra Kumar very close to Vaijayanti Mala in one of the old movies. I think it's Sangam. I do not remember. It could be Sangam. And what he said was his heart was beating faster. Kuch ho jayega mujhe. ऐसा लगता है कि I will die. And when he said this, and people come to you with the symptoms. Heart is beating faster. Maka zatal hai, kutto zatal hai maka, how martal hai. And when they say that, they come with a thick file. Physicians have dhulai kar deta hai. Hundreds of ECGs, all the tests, not intensely, but because to allay the fear of the patient. And sometimes one physician will look at the ECG and say, ECG is okay, but khalas. When you say ECG is okay, but you are gone, which means that kuch to hai. And what is it that we need to do? We need to understand and listen and call this patient the last patient of the day and say, listen to me, my dear friend. Your brain is playing games with your heart. It is the main switch that's the problem. The bulb is okay. The bulb will not stop. It's the main switch. I need to treat the main switch. And they'll ask you why. Then you'll ask them, Tuka stress asa? And they will say, I have no stress at all. Everything is all right. My family is all right. My husband is all right. My children are all right. I do not know. Then you slowly explore. Did you see any death in your family? Did you see a dead body? Did you hear about anybody's death? Did you see an accident around you? Have you had any traumatic incidents in childhood? I still remember this man who came to me perfectly. There was no history at all, but there was one history. And that was that he had seen the screenshots of the Chinese first impact of the COVID wave. And when he saw that, those images were locked in his mind. When the images are locked, there are no visible symptoms in the mind. The symptoms are in the body. And the symptoms are basically the most important symptoms are that I feel like choking, breathless, dizziness, giddiness, trembling, tremors, wanting to pee again and again, and a feeling of impending doom. And remember, this is the bread and butter for family doctors. And this should be treated by family physicians. They should not be referred to psychiatrists at all. They should be treated by family physicians. And you have to be very careful. You have to check for stress, as I've said. Sometimes, without any trigger, you can have a panic attack. Without any trigger, you can have a panic attack. You may have phobia, anxiety at particular situations, which means inside a closed lift, at heights, open doors, closed doors, darkness, etc., etc., etc. And at all these places, you might feel extremely anxious and have a panic attack. One thing is very important. In the elderly, depression can present as panic attacks. So you need to probe. You need to probe. And then you need to ask for sadness and other symptoms. And then you will find that the presenting symptom was panic, but the underlying symptoms were a depression. Psychiatrists miss panic for depression. Psychiatrists overdiagnose depression. And family doctors underdiagnose depression and diagnose depression as panic attack. So you need to be very careful. And the fourth thing, which is very important, is postpartum depression. And that can present as, I feel so scared, my heart is beating fast, I don't feel like looking at my child, but I feel something is happening to me. I can't take care of my child. I wish that the child is taken care of by somebody else. That is not panic, that is depression. And so we need to be very clear on when you look at a panic attack, go beyond the panic, check whether it's only panic, check whether there's any story behind it. Sometimes panic attack can come without any story. In those who are extremely anxious in families, it can run in families. So the best treatment is kill the panic attack by a benzodiazepine, kill it. Shoot it down by 1 milligram of clonazepam. The patient should say, I feel extremely nice now. How did it go, doctor? You're God. No need to refer a panic attack to a psychiatrist. Remember one thing, common psychiatric illnesses, minor psychiatric illnesses has to be treated by a family physician. Complicated psychiatric illnesses should be seen by a psychiatrist. Simple panic attack, simple anxiety, simple depression without suicidal ideations, without intake of any substance, and without bipolar disorder has to be treated by a family doctor. Postpartum depression, simple, no suicidal ideations, has to be treated by a family physician. So learn to treat psychiatric illnesses. Every other field has snatched everything from you. The pediatricians are giving polio drops. Neurologists are treating psychiatric illnesses. Surgeons are treating malaria and dengue in the hospitals. So you need to take care of psychiatry, will earn more. This second sentence, which I always share in the last 2 years, mind and body are in constant conversation. Equal attention to both helps immunity, health, and equanimity. Extremely important. And this sentence, when you tell the family members, they understand that they should not take care only of the body, they have to take care of the mind. Because when you take care of the mind, body is also taken care of. And this helps immunity, health, and equanimity. My dear friends, unusual presentations of depression. I feel very tired, doctor. I don't know, I've done all the tests, including the PET scan of the entire body. I don't know, I feel extremely tired, extremely exhausted. I feel so exhausted that I can't describe it to you. This is not chronic fatigue syndrome. This is depression. And when you treat them with a tricyclic imipramine or amitriptyline, commonest use, or dosalpine, that is Dothip or clothianidine or doramine. Or if you treat them with SSRI, small dose of escitalopram, 5 mg, you say 20 mg, or if you treat them with sertraline, 25 mg to 100 mg, Or if you treat them with fluoxetine 10 mg to 40 mg, you'll find depression goes away, energy comes back, and the patient starts saying, no, exhaustion is gone. Doctor, what did you give me? You gave me an energy pill. So important. And maka tired zata, I have no energy left at me. All reports are normal. Hemoglobin is 15.5. Everything is perfectly all right. And there you have to suspect depression. Again, this unusual presentation, but you need to be very careful. You have to differentiate agitation from anxiety. Anxiety means maka bhiran jata, hum bhita, bhiran jata, maka hum bhita, maka kalna, hum martal hai. Anxiety, agitation. I'm restless, but I can't stand it on place. I think I should go up and down, up and down. I feel so agitated. Tula maru ki khud maru. Feel like breaking things. Feel like hitting myself. Killing myself. Agitation. Once there was a 16-year-old boy who broke things in the house. Since 8 days, they came to me. They said, no love affair, exams doing well, money is good, attending everything properly. And the family doctor came in and told me, he said, could it be adolescent crisis? I said, no. Adolescent crisis will not start suddenly at a point of time and he starts breaking things. This is adolescent depression. And one tablet of sertraline, 50 mg, the boy's entire anger goes down. One more important symptom in this boy was, after he broke things, he felt very, very guilty. And that is a very important sign, feeling a lot of guilt. When your wife or your husband slaps you, and then he or she feels guilty, that is depression. When he or she slaps you and abuses you, then that is not depression. Remember that. So there is a lot of pachtawa, there's a lot of remorse and regret in agitation. I like to share this famous word which you need to really have it in your brain all your life: psychomotor agitation. Mind is also restless, body is also restless. I think I should break that thing. I should run away from the house. I get up at 4 o'clock and I go up and down as psychomotor agitation, not anxiety. Anxiety is something happened to you. I get thoughts about the past. I get thoughts, oh my God, when I was pregnant with my daughter, I did not eat the laddu which my mother-in-law gave me. That's why my son is not doing well. My daughter is not doing well in exam. You go in the past. An anxious person will be worried about the future most often. And a depressed person will have regret about the past. Psychomotor agitation, by heart kar do, dimag mein ghusne do. And when somebody walks up and down in the banquet, doctors walking up and down the banquet, restless, point out and said psychomotor agitation. Then there is psychomotor retardation, which means, I still remember I went to a school and after my talk, they brought me to the trustee's room. Badam, samosa, bamsa, wafer, chai pilaya. And then the principal came and whispered in the ears of the trustee. And she said, there's this boy, sir, he's not coming to school for 6 months. We have sent letters and letters and letters. And he has not come. He stays just opposite the school. Nowadays, these boys and girls are very bad. Parents also are very bad. I think we should remove him from school. Harish Shetty has fought all his life to see to it that the kids remain inside the school. I have fought exclusion all my life, court cases, etc., etc., etc. And I told, what happened, ma'am? And she said, this opposite the school, this boy is staying, and I don't know, he's not come. We send letters after letters, phone calls after phone calls. I said, why don't you send a teacher? Good teachers don't make home visits. Great teachers do. And I said, since I'm here, it will take me 10 minutes. I'll come with the teacher. And when I came with the teacher, I went inside. The father was very apologetic. He had sent certificates of malaria, dengue. Last certificate was of COVID. He said, oh, he's sleeping. This was during the first wave. He's sleeping. He's not getting up at all. He's not attending online classes. And I think he's lazy. Nowadays, kids are spoiled. He's not taking drugs. Doctor is eating less. And he's lying on the bed, not coming up. He's lazy. I said, this is not laziness. This is psychomotor retardation. There is psychomotor agitation. And there is psychomotor retardation. And then I told him, Amitabh Bachchan said once, "दो बूंद जिंदगी की, मैं कहता हूं एक या दो गोली खुशी की." And when we started him on escitalopram, the boy came back to school in 4 weeks' time online. So the principal learned one of the biggest lessons in her life, that never believe that a child, if he's refusing to come to school, if a doctor is refusing to come to practice, it's not because he or she is not interested, he's lazy. It could be psychomotor retardation, a very important symptom of depression. And when we do all this, we need to look at one more symptom: excessive guilt. Excessive guilt. I bought a house the other day. A man said, "I bought a house with EMI. My father gave me half the money, and I don't know what's going to happen." I troubled them a lot. My father is 68 years old. I took all his money. I feel extremely guilty, doctor. My mother has got a knee operation, and that knee operation, she's not able to walk. Doctor, I feel extremely guilty. I'm responsible for all the ills and the woes in my family, and the best way for me is to die. Depression. Excessive pathological guilt, depression. And it's so important to understand that when somebody has exaggerated guilt, you need to overdiagnose depression. Remember, doctors at this point of time in life, and depression is endemic. Mind has not changed its size, brain has not changed its size, shape, color, volume, weight, and even textures. But depression is increasing. Why? Because the environment is changing. So cell depression, cell antidepressant, which means err on the side of treating the patient for depression if you are in doubt. Excessive guilt responds to antidepressants. And always ask every patient who's down in your practice, do you feel like dying? Gone are the days when you have been trained to say, "Gol, gol, pucho pehla." Ask them whether they feel like living. Then ask them whether they feel God should really take them. Then ask them whether you feel God should actually take them now. And then ask them whether you want to end your life. But the times have changed. Now, what was in the realm of elicitation, the question of suicidal thoughts, is in the realm of inquiry. Which means what? Malaria, we ask straight. Ta pani thandi ahe ka? Do you have fever? Which is straight. We don't elicit. Oh, tumcha jawal koni machhar ala hota ka re? Did you see a mosquito under your bed? Did the mosquito actually bite you? We don't ask. We straight away ask. Do you have fever with chills? Similarly, we need to ask straight, do you feel like harming yourself? And remember the myth that people believe that when you ask a question, you will actually put a thought in the mind of the person is false. If you ask a question, people might say, "How do you know, doctor? Are you an astrologer?" Actually, I've been feeling that for a very long time. Refer them to a psychiatrist. So important, my dear friends. So important. Excessive guilt is a very important sign. So, my dear friends, in COVID, we saw apathy, empathy, and antipathy. Apathy, shut down. People are dying all around. The mind shuts down to protect yourself. No mood to send your condolences to your neighbors. No mood to actually to do anything for anybody. And you shut down. And when you're numb and you shut down, there's no empathy. Empathy ke liye, you need sadness. You need to feel sad. For empathy, you need to actually have emotional regulation, equanimity, samanta in the mind. And then you feel like empathizing. So many of you have helped so many people in COVID. That's because you had empathy. But antipathy also prevailed at that point of time. And I will tell you, I still remember this boy whom I was treating for depression. He was not improving. Medications, counseling, therapy. He had lost his parents. And there was no improvement at all. And when there was no improvement at all, I asked, is there something wrong, my dear friend? And he or she said, yes, doctor, my sister abuses me all the time. And when I got the sister there, she said, Dr. Shetty, my brother, this boy, was responsible for the death of my parents because he was going to work and he got COVID. We all got COVID and my parents died. We both have survived. I can't look at his face. I abuse him every day. And then I called the sister and I sat with her and said, as she shared and cried and cried, I said, my dear sister, it is the COVID virus that killed your parents. It was the COVID virus that infected you and your brother. He did not kill your parents. So antipathy is also seen during COVID. So some people, you may have a cycle of apathy, antipathy, and empathy. And that is a very important phenomenon we see when there's a disaster of such a magnitude. So my dear friends, how to explain to patients whether it is stress or depression? Stress is something you fail in exams and you have a breakdown, but friends help you, you go for a holiday, you cry and people help you, and you feel better. That is stress of the mind. Man ka moch, man ka lachak. But when you have depression, it's a fracture of the mind, which means what? Which means kuch bhi karo. I just cannot do yoga. I just cannot appreciate all the good things that people have done to me. I see a slum in Goa and Switzerland to be the same. Nothing moves. There's paralysis. The mind is like a stone, and that is depression. And when people say, make me all right very fast, should I actually ask the patient to do yoga? I said, if you have a fracture of the hand, we ask the person to lift a bucket. And that's exactly what happens in depression. Depression is, it is an invisible illness. It's very cunning. It comes in many disguises. And what is important is fracture of the hand is visible, but depression is invisible. So you need to make the invisible visible. And you need to really educate a lot of parents and relatives not to give advice. 3 wrong things which parents or relatives say. 1, nothing has happened to him. All reports are normal. Acting karta to. Look at him. Everything is okay. And I tell them, gentlemen, you do not know what is happening inside him. And when you say that in front of the depressed patient, he feels you have understood it. You do not know what is happening inside him or her. You really do not know what is the agony is. For him, a small ant is like an elephant. A small phone call is like picking up a quintal of rice. And depression is so invisible that you need to understand what it is. And when the parents start empathizing and they do not say that you are acting, they do not say there's nothing wrong with you, they don't suffer from look at me syndrome. The look at me syndrome is very dangerous. Huh? Maka pade. I have faced so many troubles in my life. I get up at 4 o'clock and do yoga. Why get up at 4 o'clock? Sleep? No. Look at me. Arre Baba, तेरे को depression होएगा ना, तेरे को भी ऐसा ही होएगा. You'll also suffer in the same manner. So making the invisible depression visible to the close members of the family helps recovery. And that is so important. As I said, depression is very cunning. It can come in many disguises. This is Ravan coming in the form of a sage and abducting Sita. And this is a very apt picture. Now, what can you do? My dear doctors, भर के SSRI देने का. पर एक बात है, ask one thing, suicidal thoughts, history of mania, hypomania, history of substance abuse, any complicated depression, psychiatrist. Simple depression, you can treat. SSRIs, escitalopram, sertraline, paroxetine, fluoxamine are SSRIs. And you can actually give it in the first episode of depression, 9 to 12 months after recovery, and tell them at least 9 to 12 months. A lot of patients will come to you and say, I'm better, please stop my treatment. I tell them, you stop eating your food. You have been eating your food for 45 years. You're addicted to food. Stop eating your food. I also tell them sometimes that you have a car, you take the car for every 5,000 kilometers to the garage because you need to check the car and you need to maintain the car. So I use a lot of metaphors and analogies to see to it that the patient do not stop medications, because stopping medications early can cause a relapse. And Indians have this habit, when they go to a vegetable market, they need to decrease the cost of the vegetables. How come karega kya? And when they come to a doctor, a psychiatrist or a GP, they'll say, stop the medicines. These are sleep medicine. And a lot of myths around that, kidney kharab hoega, liver kharab hoega. But I tell them in Marathi, bhaji poli goli. You need to take the pill for your mind. This is Khurak. And you can use SSRIs, you can use tricyclics, amitriptyline, imipramine, nortriptyline, dosulfine. Very important. And among the benzodiazepines, lorazepam, clonazepam are the best. Avoid giving alprazolam. Sometimes it's very difficult to really withdraw. Anxiolytics, you can use etizolam is also a good anxiolytic. You can use Bipron also, which is good. And you can use a few other drugs. These are drugs which you can safely use. And when you treat somebody for depression on your own, keep in touch with the psychiatrist so that you are covered. And when you treat depression, when you treat 5 patients of depression yourself and the patient recovers, you have more confidence in treating many. My dear friends, I said this, there is no strong mind. Mind is not made of iron or steel. It's made of neurons, and you have to nourish it always, always. Nothing to worry. Samuel, I'm going to send you the entire set. Don't worry. And the mind is not made of iron or steel, it's made of neurons, and nourish it always. So, my dear friends, you guys have a very low hit of the COVID virus. When Maharashtra lockdown खुल गया, जैसे शेर जंगल से भागा है, माँ कसम, चलो दारू पियेंगे, कसौली जाएंगे, कसौली क्यों यार, बम्बई के नजदीक करजत है, and we go to Maldives, Mauritius. Base camp, म्हणजे काय अवती भवती काय दिसतच नाही त्यांना. They don't see any good things around. It's like saying that we should go for the beauty pageant in Italy. अरे आजू बाजू में क्या हो जा रहा देखो ना. That is so what happens when you're locked? You unlock. Why? Because you have not practiced mindfulness across the time of disaster. So unwinding would mean पहला नेबर्स को नमस्कार बोलो, तुम्हारे घर में कितना लोग जिंदा है. We do it in Bombay. We do not know who has died, who has not. I have lost 2 people in my own family, and that has been very difficult. Talk to your friends very close by. Instead of going to Kasoli, Karjat, Kalsubai Park on the Sahyadri, a good place to trek. Start with little joys, mindful gatherings. And I have used this term today in my Sunday talk, which we have been doing with Dr. Shashank Doshi for the last 2 years. And I said, there be a pandemic of mindfulness. Mindfulness, the power of mindfulness is recognized never before but today. Anybody who's practicing yoga, practicing vipassana, practicing any form of meditation, the rosary, the tasbih, or practicing silence, mindful silence, will do much better than those who are distracting themselves with other things. I still remember this man was running and having alcohol every day. And then when his wife came to me, I checked with him. He said, I get a lot of thoughts. I was admitted in the hospital. I was in an ICU. I saw bodies going away. I still can't remove those thoughts. Those thoughts come to me again and again. And to block those thoughts, I go and drink alcohol. It is known following a disaster, alcoholism and addiction increases. It is known following a disaster, high-risk behavior increases, and HIV incidence also has increased in the past. So unwinding would mean little joy. Thoda milne ka. And Goa, well, everything is open because Goa has had very little hits. Other day, a woman lost her husband, a doctor of repute, in spite of 2 vaccinations and in spite of antibodies. Well, we don't know what happens. COVID only knows whom to kill and whom to save. And after that, this woman has not grieved. She has not cried. And since the boy was my friend, we went to her house and she said, the children always watch me. They don't allow me to cry because everybody says crying means their self-esteem will get destroyed. Are bhaiya. And all these guys in families, I am the pillar of the family. Kaiko, Kashala. Has any building stood on one pillar? Have you seen a building standing on one pillar? No. A family has pillars, little pillars, middle pillars, intermediate pillars, and big pillars. And when I cremated my auntie alone with my nephew, everybody was positive. I was crying like a small child. My nephew was crying like a small child. And the small pillar was consoling the big pillar, and the big pillar was consoling the small pillar. It is so important to cry and pass this actual message to your family members. जो बह गया वो पानी है, जो रह गया वो जहर है. The mind and the body, there's a lot of poison if you stop the tears, because then there'll be a lot of trouble inside your body. So always understand that tears are liberating, never stop them. As I slowly stop, remember, a family that cries together heals together. They say the family that prays together stays together, but a family that cries together heals together. Building does not stand on one pillar, it needs multiple pillars to stand, and all pillars are equally important. Well, if I say United States of America, POTUS has told the US Navy, Pentagon and the US Admiral has told the US Navy that on your ships, you have the yoga. Yoga to hoga. Yoga is not a retirement policy. Yoga is not for bored housewives. It's for you and me from the age of 3. From the time we start breathing till we stop breathing. And this is a very powerful antidote for stress. And this is part of your mindfulness exercise. And as I stop and take all your questions, yoga calms down the amygdala. We do not become phatkal or mufat. Yoga improves our prefrontal cortex. We take decisions properly without any rush. Yoga improves the limbic system and the hippocampus, improves memory in school children. And yoga has a lot of other beneficiary activities. Recently, in a research by IIT Bombay, among MBA students, they found that with yoga, their grades improve, the interpersonal relationships improve, and the mental health improve. There are enough evidences, meta-analysis of multiple studies. And remember, 15 minutes of pranayam is much better than half a peg of whiskey. Exercise dissolves fears and tears. And for all the moments here, if I ask you what is black dog, you're going to tell me it's a whiskey. No, black dog was a term which Winston Churchill gave to his depression. And the WHO made a 4-minute movie on black dog depression. And you should advise every patient to watch it, because that says that exercise is an antidepressant when it is mild, when you have stress, and as an adjuvant with other medications when the patient is improving. Well, diet, as you know, has a very strong correlation with mood, sleep, and a lot of insomnia, a lot of sleep deprivation has been seen in COVID, and a lot of disturbance in hypothalamic pituitary adrenal axis. A lot of cortisol reigns, and a lot of people also can really disrupt sleep. Panchamrit means you need to sleep. And the last is kindness. My dear friends, as I stop, I would like to say, you need to tell all your patients, time is not always the best healer. Photo mat khich, main tere ko bechta hu. And you would say that your time, and everybody says, time, it will all get healed in time. God is there. Praise the Lord. Hallelujah. You might say our Kul Devta, Shanta Durga, will go and he will take care of everything time. Are what time? When sugar is 500, you say, time se sugar kam ho jayega. When you say your BP is 190, you say, time se sala BP kam ho jayega. No. When you drink 2 bottles of alcohol, you say, time se sab kuch liver acha hoga. Nahin. Time is not always the best healer. I would like to share an anecdote. After 1 year of the disaster at Latur, I still remember the senior IAS officer saying, we have built all the houses, but mental health hai na, samay se acha hoga. And I told him, I was younger and a little bolder, a little plucky, little spunky, but even I am still the same. I told him, sir, that fan, if it falls on your head and you start bleeding while you're talking, will you say, this bleeding will stop after some time? No. Time is not always the best healer, and in a disaster, in any mental health event, time does not help. What helps is actually intervention. And my dear friends, I would like to say, kindness has been found to improve immunity and improve mental health. Harvard has a study which says when they show films of kindness of Mother Teresa, IgG improves. Hypothalamic pituitary adrenal axis improves. My dear friends, if you have stopped talking to any of your friends for 20 years, MBBS में उसको अपने से anatomy में उसको ज़्यादा मार्क मिला, बाद में साला वो मेरे को भाव नहीं देता था. Then I stopped talking to him. Pick up the phone and to talk. If your uncles or your aunts have snatched all your property and you have stopped talking to their cousins, to your cousins, tell yourself, हम नफरत के बारिश नहीं बनेंगे, हम फोन उठाकर बात करेंगे. If you have somebody somewhere staying alone, old man, old woman around your area, pick up the phone and talk. And I would tell each one of you, call up every person on your friends list in the phone and ask them, how are you? How are you is one of the most important interventions post-COVID. And I'll tell you, when kindness oozes from your heart, your mental health improves, you become a better human being, and you become a complete human being. Life has meaning, and meaning in life is an antidepressant. Meaninglessness is a cause of depression. With this, I thank Goa General Practitioner Association. I thank my dear friend Samuel, and each one of you have joined. I have finished the presentation a little early so that I can answer your questions. Thank you.
So thank you very much. There are 4 questions. Can I take one by one?
Yes, of course.
Yes, sir.
Thank you, Samir, for that beautiful sentence, Dr. Samir More. Thank you.
Yeah. So by Dr. Sachin Kumar Khade, comment on time management in medical profession.
My God, what a phrase. There is nothing like work-life balance. All those guys who must have come and given you all lectures on work-life balance, all bullshit. Work-life balance is a myth. Imbalance is the truth. Finding balance in imbalance is the key. Arey, you're a doctor at night. Somebody says, my father has got chest pain. I called all doctors, they were not there. And your wife says, I planned a dinner. Where will you go? You will go to the patient. So time-life balance, work-life balance is a myth. Finding imbalance is the truth. Finding balance and imbalance is what is important. But I would like to also add, my dear friend, find time for half an hour of exercise and 15 minutes of yoga. I walk 7,500 steps inside my house every day. Come what may, I go late. And I do 15 minutes of pranayam. Sometimes if I have to go late, on Monday morning, I have an appointment at 9 a.m. So I may miss that. But what I'll do is I'll compensate for that on Tuesday. So 4 to 5 days, I'll do something which is important for me. My dear friends, if you're unwell, doctors, remember, don't stretch your physical health too far. The patient will find another doctor, but your wife or your child or your husband will not find another father, another mother. And that is important. Thank you, Sandra.
Sir, beautifully explained this question. The next question is with the same Dr. Sachin Kumar Khade. Give some guidance to relieve anxiety and stress related in critical patient management in ICU physicians.
Yes, definitely. Thank you, Sonal, for your kind words. Thank you, Nisha, for your kind words. Thank you, Dr. Bedekar, for a lovely phrase which you put. Well, in critical care, remember, you have to use humor. I'll tell you, there was an 84-year-old woman who got admitted in ICU after COVID. And she survived. Huh? She would say, nurse, tu itna dur kyun sala khada hai? Idhar aana, paas mein aana. How are you? How is the family? How do you work so hard? And the nurse got so touched and she did everything for that lady. Similarly, she did with all the doctors. So what is very important is 5 things. Number 1 is, as a critical care expert, remember, my dear doctor, work in pairs. No critical care expert is God. अपने हाथ में patient मरने वाला है, कुछ patient घर जाने वाला. So please work in pair. I once told a very great critical care doctor, share your emotions at the end of the day. Because I have no time to share emotions. We go from one patient to the other. And if you share emotions, what will happen is will be ineffective. मैं बोला G. मैं G बोला. I did not elaborate the word G. I said G. And then I told him. And then I told the critical care, if you block your emotions, remember my first slide, you will not be able to help the other. You should not become dehumanized. The morgue attendant becomes dehumanized. The cop who refuses to be aware of his emotions gets dehumanized. You don't get dehumanized. If you get dehumanized, you will not be able to love your family the way you love them, the way you would want to love them. So at the end of the day, 2 critical care guys would sit down and have a cup of coffee and say, साला वो फिट पे वो साला उसको मैंने ऑक्सीजन दिया, मेरा इतना दिमाग से थक गया, लगा हो गया कान के नीचे में 2 बजाऊंगा. And other fellows might say, I did so much for this patient. 88th day he was good. In the morning was talking to a relative and he died suddenly. I feel so bad. So this feeling sharing is important, and that is number one. Number two is for the critical care doctor saying bye to the person who's leaving home. Be once in a while, once in 2 days, if a patient is going home, leave the patient up to the gate, and that really improves the mood of the patient and the doctor. It becomes a memorable event for the patient and for you, and that improves the mood. That improves the mood of the critical care patient as well as the doctor. Third thing is, sometimes, my dear doctors, patients don't go vertically; they go horizontally. And I remember when I claimed the body of man, there was only one nurse, and she did not know what to say. She only knew what are the papers I should sign. And at that point of time, once in a while, when somebody goes and the dead body goes up to the ambulance, it's a nice thing to give a nice bidai, to go up to the ambulance, do this, and say, "All the best, we are with you." And that keeps the mental health of the critical care specialist good. Now, what should you do inside? Inside, number one, teach the nurses what to talk and what not to talk. And the new nurse comes, first class, "Arey, 28 or 28 kidhar gaya?" "Wo to kal gaya." The second nurse says, "All the patients are listening and their heart is about to stop." That is number one. Number two, human conversations as much as you can, non-verbally and verbally. I still remember when one of my psychiatric patients, psychotic 68-year-old, was admitted with hypoxia, not COVID, much before that. I went there to the ICU and I just did this in front of the doctor and the relatives. And she came back and said, "Never in my life in the hospital as any doctor." I still remember. So human interaction, human conversation, a little humor also. I still remember a police officer in the ICU, when prone position of COVID, asked for a flute. He was a flute player, and we gave him the flute, and he started playing the flute. And the entire COVID ward was happy for a few minutes when he could play. So improving the mood, being funny, not when somebody is very serious. You should know when to be funny. Provoking laughter, touching the heart of the patient, not only improves your mood, but improves theirs. I always have this famous quote which I use all the time since last 40 years. When you smile at the patient gets healed. He might not improve. He gets healed. He might not improve. And when the patient smiles back at you, you get healed. So we need to do a lot of these small things inside the critical care. And a critical care specialist, when he comes home, do not carry your visiting card. So many critical care patients come home with big faces. औरत को समझना चाहिए मेरे को क्या होता है. Wife should know what is happening to him. Hey, the most critical care doctor in the entire universe is the mother, is the wife who cooks for you. That is the most critical care. So you need to leave your card behind, leave your designation behind, but when you feel sad, you can share with your spouse. Sometimes your spouse may be one of the most important healers for you, and he or she might understand. So let your tears flow. Allow your smiles to be infectious, because tears and smiles are two sides of the same coin. Experiencing both will keep your health better and will help you to be a great doctor in the critical. The other day, a critical care doctor lost a patient. He lost a doctor, and then two of his friends abused him. तूने साला उसको ये ड्रग क्यों नहीं दिया? He said, वो evidence में नहीं था. Then somebody said, तूने उसको ये क्यों नहीं किया? I fired those two doctors. I said, after somebody is dead, in spite of all the effort, you are abusing that doctor. You should first find and ask him, how does he feel about what happened? Console him, help him feel good, because we are not gods. Some go horizontally, some go vertically. We need to support each other, and that I think is very, very important. Thank you, Samuel.
So very truly said. Human touch and humor is very important for the critical patients. By Dr. Sanju Yadav, is there anything such as abnormal excessive crying?
Very true. Thank you, Sanjeev Kuril, for your beautiful words. Thank you, Gajanan, for so nice. Thank you, Sachin, for your kind words. And thank you, everybody, for all your kind words. Yes. Tears ka range hota hai, boss. जैसा फिश का भी होता है ना रेंज, छोटा पापलेट का कितना प्राइस, कापरी का प्राइस ज्यादा, साइज के ऊपर प्राइस है ना होटल के अंदर या मच्छी बाजार में. तो समटाइम्स टीयर, सम पीपल आर वेरी टीयरफुल, पिक्चर देखते तो रोता है कोई, वो दैट्स द नेचर, दैट्स ओके, दैट्स परफेक्टली ऑल राइट. Some people cry with certain people. There are some patients who cry with their doctors. You know why? Because they are ashamed to cry at home. They are heads of the families, and they're ridiculed if they cry with their families. And there, what happens is very important for the doctor. It could be a small stress, it could be a small hurt, and he or she wants to share that with you. He or she is not interested in any answers. And as long as the tears are not affecting their life, as long as they're able to experience cheerfulness and joy, as long as they're able to do their work as well as they can, as long as they are able to interact with the world around and they are in balance with themselves and outside, perfectly all right. Third is tears which are a little more. I don't know, but when I see a sad scene, I've started crying. And it has started at a point of time. When it starts at a point of time, there is something happening inside. It could be a story in your life. It could be an event in your life. It could be something coming from the past. It could be andropause or menopause. It could be low vitamin B12, low vitamin D3, thyroid, etc., etc. So you need to check all that and treat it as a physical issue. And then if a person is very tearful, check for depression and treat your depression. But there's one quote in psychiatry which is very important. All those who are crying may not always be depressed. And all those who are depressed may not always choose to cry. So tears, respect the tears. Tears have a story. And it's important to go to the story, and it's important to heal excessive crying, because sadness is a positive emotion. Depression is a negative state. And those who, lastly, Samuel, if those who block tears, नहीं आने लगा होत नहीं आने लगा आमी मोहब्बत से अमिताभ बच्चन परंपरा प्रतिष्ठा और अनुशासन इस गुरुकुल के 3 नियम है. And those who do not experience sadness, they cannot love. And those who cannot experience sadness, they cannot experience joy.
So all emotions are important.
And those who have intense hate interferes with love everywhere. If you intensely hate your mother-in-law, you can't love your wife or your husband. And that also is very, very important. So anger is a positive emotion. Resentment is a negative state. So experience anger, makarageta. Anger is positive, but humiliation, aggression, and insulting somebody is negative.
Sir, by Dr. Sachin Kumar Khade, how to combat depression in medical professions.
देखो भाई, गोल्ड मेडल से तुम्हारा पैसा का इक्वेट नहीं कर सकता. If you are the best doctor in the medical college, it might not equate with what you have in the practice. Sometimes you might have I-10, and sometimes somebody may have a mark. As and when I go to Goa, when Samuel picks me up, I feel very low. I feel ये साला घूमता है मर्क में, अपन साला बम्बे में भी मर्क में नहीं घूमता है. And that is a feeling you might have. But what is very important is, and that I have been able to get into my system, is that nishkam karma. Continuously do your task without bothering what happens. And when the fan goes around your head, you know that on that day, you have been nice to your patients, you have been fair to your family. You may have made mistakes, and you're prepared to correct those mistakes. And COVID has really reminded us that we are temporary travelers on this earth. You should have aspirations always. You should be ambitious always. But at the end of the day, ask yourself, is there tranquility? Is there peace? Is there equanimity? Are you able to talk to your friends the way you talk to them when you started your practice? Envy is very, very normal, but pathological jealousy is abnormal. So in this short span of life on this beautiful earth, see that you chase peace, and joy is a byproduct of peace. I think that is something very important. As and when you are in a crisis, please seek help from a psychiatrist. Don't hide. And as and when you practice and you get bored of practice. Remember, Samuel, there are some people who said, "Kaisa practice hai? A routine hai. How's marriage routine? Which means you've lost your zest." Go to CMEs, learn more, meet people outside your practice, read literature, read history, run, sing, and see to it that your color of life, your leisure time, is occupied with something very nice and very good. Thank you, Samuel. There's no perfect remedy, but please, Panchamruta,
Yes, sir.
sleep, diet, exercise, and kindness.
Dr. Praveen Rathod has written, it was wonderful presentation. Can we get the PPTs of presentation? Yes,
I will,
doctor
I will,
has
I will
promised that.
send it to Samuel. He can give it to everybody.
Yes, definitely I
Ideas have
can
no
share.
ownership. Ideas have no ownership. It has a life, energy, and a duration of itself.
I would tell the participants that it is on YouTube also, it is going on live, and if anybody wants to see the presentation again, can go visit YouTube and see. Uh, the next question is, sir, Dr. Sachin Kumar Khade. We always compare our profession with other. How I can say confidently my medical profession is great.
Well, my dear Mr. Khade, there was once my guru, Professor N. Vig. He was a psychiatrist at Chandigarh. He headed the World Health Organization, Southeast Asian. He's my guru. He once came to Mumbai and we gave him the Lifetime Achievement Award. We asked him to send his CV. He sent a 5-line CV. And we were very shocked. And when he came, I asked him, sir, 5 line sim likha hai. He said, as you grow, your CV should shrink. And it doesn't matter. From that day, I also thought, but people chase me, so I sent. And he said at the end of his lecture, if I'm born again, I will still be a psychiatrist. And I repeat this again, if I'm born again, I'll still be a psychiatrist. My dear doctors, we change lives. We actually change lives. And we are not paid as much as we should for changing those lives. We bring smiles in the face of our children, our patients, adult patients, and elderly patients. We get so much love. People invite us for the kids' marriages. People wish us on festivals, give us sweets. They pray for us. In Goa, every patient prays for the doctor. I mean, they go and will pray for you, they say. And still, in spite of all the negatives we hear about the consumer code, there's still a lot of regard for us, much more than the CEO of Wipro, much more than the CEO of Infosys. And I'll tell you this, whenever you go out in a shop, suddenly somebody pats your back and says, doctor, you know who am I? And a senior doctor, family doctor at the age of 60 or 60, they like all teachers, they pretend, yes, yes, yes. And they say, no, doctor, you don't remember me. I came to you 20 years back and you gave me one advice and a few tablets, and I was so scared. You changed my life. Can ever, in any field, anybody can ever experience this joy? This is only exclusively for the medical practice, and we should be proud of that. And I say that again, if I'm born again, I'll be born, I would like to be born and be a psychiatrist. And how much you earn is not what is it. What you are is more important than what you have. I think this is the philosophy.
Sir, in Goa, all at least 90% of patients they say Dev tuja baro karo while going. Yeah.
Yes,
And
absolutely.
because in Konkani language there's no thank you word.
Yes, sir.
So they
No,
say
no, no.
Dev
One thing,
baro
one
karo.
thing, one thing about it, Samuel. I mean, I'm a little biased.
Mhm.
A lot of Catholics and Christians always say this all the time. It's very good to hear. And even Hindus, मैं तुम्हारे लिए प्रार्थना करता हूँ, आपका
Yeah.
सब भलाई हो, is something which is so common in India. I don't think it is seen anywhere
And
else.
it's more in Goa.
Oh yeah, yeah,
I have
absolutely,
stayed in other states, but here it's absolutely
absolutely, absolutely.
90% of patients they
Yes,
say.
Samuel, absolutely, absolutely.
Yeah. So next question by Dr. Pankaj Lakshman Chavan. It is harmful to be too honest and ethical in your practice. Since after being 100% ethical in treating the patient, he might not understand or appreciate it. You want
Absolutely.
to say something, sir? Yeah.
Yes, yes. My another teacher, Professor N.S. Vaya, he's late N.S. Vaya, and Professor Big is also late N.S. Vaya. He was the man who brought psychiatry to India in the 40s. And in KM Hospital, he was given a constable and a place adjacent to the morgue to start a department. And he was the first person who did some research on yoga and mental health in the 50s. And in the 90s, I sat with him for long years. He was old and he sat with me and he really taught me Patanjali's Yoga Sutras, translated in Sanskrit into English twice. And when I sat with him, he told me something very important that has stuck to me. Dr. Harish Shetty, 50% of the patients will praise you and 50% of patients will talk bad about you. And remember one thing, when they praise you, you may be surprised why they praise you, because you did your duty. And when they really say bad things about you, you might feel, why the hell it happened? I think it is important to be ethical. It's important to be honest, because you are answerable to your conscience. You are not answerable to anybody's conscience. Remember one thing, you might face a lot of trouble even when you're honest. But one thing you have to be very sure is, ultimately at the end of the day, when you close your eyes, you are talking to your conscience. You're not talking to somebody else's conscience. You're not speaking to the article on the front page of the newspaper. An article in the front page of a newspaper dies the next day. Tomorrow is a new day. Your dialogue with yourself is more important than your dialogue with the judge in the consumer court. It's more important than the dialogue with the judge, with the newspaper journalist. It's more important than with the dialogue against anybody. So ultimately, you'll find that you will attain peace. And what is also very important is, let us not share a wallet. Let us always share a knowledge. Sharing knowledge is the biggest ambassador for all doctors. So I would say, if the MRI guys comes with an envelope with a check, don't take it. Don't take it. He has to earn. You might say give concession, but don't take it. Because as long as a doctor, you'll never starve. On your plate, you'll have pamphlet on good days and mandeli on bad days, but you'll have some food on. So what is very important is be honest, and you'll find yourself that you respect yourself much more than anybody else. But don't wear your honesty on your sleeve. I'm honest, sir. Honest, sir. I'm honest, sir. No, that is arrogance. That I'll tell you a story. There was this IAS officer who sat in front of me one day in my clinic, and he said, I gave him concession. He said, "मैं बहुत honest था, मैंने पैसे ही नहीं खाया." And then he said, after that, when going, he said something important. मैं पैसा तू क्यों नहीं खाया? क्योंकि मुझे डर लगता था इसके लिए मैंने खाया. So I think being honest, being ethical is important, and being smart also in practice is also important. That will stand the test of time, and will be happier at the end of the day. You might struggle, you might face trouble, but I think it's perfectly all right.
So there are another 2-3 questions. Dr. Suhas Gosavi is saying that, sir, I have seen student who was sent Marathi medium student to semi-English medium with pain in abdomen and absence in school.
Yeah. Pain in abdomen is a psychological symptom among children. Pain in abdomen, headache. When there's a pain in abdomen, most of the time it's a cause is because there's some fear about the teacher. There's also some fear about the subject, and it could be because of not being able to do your best in your subject. It could also be because that the father or the mother at home is very aggressive. It's very common to see that in children with learning disability, because they're not able to fathom, and everybody blames them for being lazy, for being not good, not applying their minds. It will also be a sign of depression. So go behind the pain. Behind every behavior is a story. Behind that story, there are many stories, and you need to really go back and check what is happening. Children who have psychological symptoms also always should be referred to psychiatrists, but also look for porphyria in children, which is also very common.
So Dr. Sonal Ambadas Saste, he writes, sir, can you please guide how to stay focused during exams?
Oh, well, this is becoming a child psychiatric conference. Well, all children who sleep well from June to March, they do much better. All children who play and spend time on leisure with their hands and legs, not with their fingers, do much better. In a family where there is less anxiety, children do much better. The temperature in the family is very important. If there's fear and if there's anger, memory goes away. Studies are like water, it evaporates when boiled. Fourth is when parents understand the important algebra formula that acceptance upon expectations has to be greater than 1, which means you accept the child much more than the expectations you have from the child. Child feels that he or she is emotionally safe with you. He feels that whatever I do, they will correct me, but they will not throw me. The child is more focused. Yoga improves the focus. Practice tests improves the focus. But remember, your child should not have a self-esteem or a self-esteem only through academic achievement. They should come from many other sources. And when a child is in crisis, hug the child a little longer and be stronger. And when there's compassion, love, affection, acceptance, focus is better. If there is attention issues in the child and he's diagnosed to be ADHD or something else, important to treat the ADHD. And at some point of time, remember one thing which is very important. Somebody has said that the nail in the coffin of ADHD is awareness. So if you improve awareness of the child, if you improve the journey of the child within, understanding himself within, focus is much, much, much better. Thank you, Samuel.
Thank you. Last two questions we will take and then we'll end. Yeah.
Yes, sir.
Dr. Sachin Kumar Khade again. How to treat post-COVID depression?
Well, like the way you treat all other depression, but answer all the questions of the patient. See that you are in touch with the chest physician who treated the patient of COVID, and use antidepressants, check for suicidal ideas, and use antidepressants as long as you think it should be. Sometimes look at neural issues of COVID and see to it that you talk to a neurologist if there's anything you can do. Also look at the fact that at the time of COVID, they were given a lot of steroids. So keep in touch with the chest physician so that the steroids are tapered. And a liaison activity between the chest physician, a neurologist, and Dr. Sachin will help the patient to improve much faster. Dr. Sachin has been asking me marathon questions on behalf of everybody, I think.
Dr. Naresh Daulatani, sir, can chronic pain not relieved by all drugs such as SSRI, SNRI, TCA be fibromyalgia, or is it depression?
Fibromyalgia is something I don't believe. Go to the pain, go behind the pain, find out if the pain is a gain for the patient, whether the pain helps the patient avoid certain tasks, whether the pain is a conversion of psychological symptoms into pain. Go into the history in detail. I still remember this patient who did not want to go and work in a particular industry, but the father was forcing him. And I went back and he said, "Dekho, mera father is like Hitler. He will not allow me to do what I want. I want to do music, and he wants me to do engineering." I did engineering because he told me, because I'm a bright guy. I can finish a course, but my heart is in music. Doctor, can you tell him? I told inside in my mind that if I tell him, he'll blow it on me. But you know what? Harish Shetty. Then I told him, I sat down with him and said, "Bapu, tu kyun iska dimag ka bhussa banata hai?" In English. And then he started crying. He said, I can't go and tell my relatives that my son wants to do music. And after a very long time, he partially accepted, and the pain actually went away. Sometimes you have to go back to stories and check what exactly is happening to the child.
Thank you very much, sir.
Thank you, Dr.
I have no words about your presentation, and as usual, Dr. Harish Shetty means a great talk, and again once more a great talk with lovely presentation, fantastic PPTs, and kindly share. I would share with all the doctors.
I will send it to you.
I thank all the participants, 244 participants to be here. And I thank again DG Shield. I thank Mr. Piyush. I thank once again Dr. Shetty to be.
I know Mr. Piyush. He was there for a show, for some other show in the past. Thank you, Piyush, for doing all that. And thank you, all the doctors, waiting to come to Goa and have a live chat with you very soon, as soon as we can.
Yes,
and
sir,
I would love to have the fish which you always give me. I love to have all the hospitality, and Goa is the most hospitable place for me, in my experience as a doctor, traveling across the country and abroad for lectures. Thank you.
Thank you very much,
Thank
sir.
you.
Thank you.